Hey guys, Ashley with Amare. So, few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, it's Ashley with Amare. And today we're going to talk about if you should, can you, or what happens when your surgeon tells you, oh, just massage yourself after surgery for the swelling. Okay, here's a bunch of problems with that. First of all, what massage are they talking about? They're talking about manual lymphatic drainage. What is manual lymphatic drainage? Manual lymphatic drainage is a gentle pumping motion done to just move the skin just like this. It's extremely gentle. You guys can see that I'm not putting any pressure on my skin. We are manually moving the skin to dilate the lymphatic vessels that are a hair thick and a hair deep underneath the skin to do their normal job, just 10 times faster, of draining back into your body, sucking the fluid back in so you can pee it out. Manual lymphatic drainage. We are manually dilating the lymph vessels to get them to do their natural job of draining. Guys, the reason we're not walking around like puffballs and super swollen 24/7 is because your lymphatic system is already pumping all the time. Anytime your skin moves, it's pumping and absorbing all the swelling and fluid from in between your skin and your tissue and your organs and everything, and you're peeing it out 24/7. This is already happening. This is not something that doesn't happen normally and we have to do a really hard thing to make it drain. That is not. I have so many videos talking about the science of it. Now, really quick, you guys know I love whipping this thing out. My map. This is a science. This is not just, I'm going to rub and all the swelling is going to go away. That's not what this is. We have a map. It's a science. It's an actual system. There's a direction. There's a flow. There's a way things are supposed to go in order for your body to reabsorb that swelling so you can pee it out. The number one problem with you guys trying to do self-massage at home, number one, you have no clue what manual lymphatic drainage is. And I swear I get told this all the time. Well, you should do a course explaining and teaching people how they can massage themselves. That is not possible. The training that we have to go through, the amount of science, the amount of anatomy, and the amount of technique that you need to learn to be able to do this is not massage. Anyone that tells you manual lymphatic drainage is just like a regular massage, they may not be properly certified because it's not. It is a specific manual technique done to get your system to dilate so you can reabsorb all that swelling a lot faster and pee it out. This is not massage. We're not rubbing. We're not pressing. There's none of this. It's literally this gentle thing. And you have to be properly trained in order to know how to do that. So that's number one, is the pressure and the science. Number two, you guys just had surgery and you're digging away at your body because you think it's supposed to be massage and it is not. And then you're hurting yourselves and you're thinking, oh, but this is what my doctor told me how to do. No. And back to me teaching you guys how to do this thing. This map, yes, there is an order to which we work on this map as far as being able to get your body to properly dilate to reabsorb that stuff. You can't just go willy-nilly pushing on things and stretching skin in all kinds of directions. There's a direction of flow in order to get your body to open up and reabsorb this stuff. There is a sequence, and I talk about this a lot in my course. The course that I do have, Post-Op Lymphatic Massage and Finding a Therapist. No, I will never teach you guys how to do this. Ever. Because you still, even if I spend all this time, make a course, teach you guys, talk to you about it in these videos, you still have no idea what you're doing because you don't have that training and that background and that knowledge, and there's no way you're going to unless you go through the thousands of hours to get that training just for one surgery. That's not going to work. So with doing the massage, the first thing you need to understand is you have no idea what you're doing. This is not just massage. Manual lymphatic drainage is a scientific technique. This is not massage. We are not rubbing with oil. There are no machines. There are no tools. There are no rollers. There's no digging. It is not massage. I do not practice, and never in my 9 years have I ever practiced massage. Do you need a massage license to be able to touch people, to be able to do manual lymphatic drainage? Yes, because it is a touch. But I have never once done a Swedish massage or a hot stone or anything like that, because that's not what this is. It is a manual scientific technique. So that's the number one reason, is because you guys don't even understand what it is to be doing it. And even if I make a course and explain it to you guys, it's going to be 145 hours. It's going to be 45 hours for your basic preliminary to just get an understanding of it. Because all the MLD certification courses out there that are legit, that's what they are. So no, you can't just take a course and learn how to do this online. That is not how this works, and I will never be releasing a self-massage course. That is not a thing. Number two, you guys can't reach. Like, I see these videos and they drive me nuts. Just so that we're aware, this whole video is just going to be me going off these points, because I've had several messages recently with people asking me how to massage themselves. That's not how this works. You guys can't reach. I saw a video the other day that somebody sent me and they were like, but this person's showing you. And I'm like, okay, but here's the 17 million reasons that doesn't work. Somebody like reaching around to do like some sort of like this. Okay, when we're doing manual lymphatic drainage, the skin has to be completely mobile and resting. If you are reaching, you are putting tension on the skin, and then you're trying to pull. So in theory, in a normal healthy person that didn't have surgery, doesn't have an autoimmune, doesn't have lymphedema, nothing like that, yes, this may stimulate the lymphatic system, but we need the skin to be in a resting state, so that it gets its full range of motion, so that we can feel those little vessels and that swelling underneath move. You can't do that. Again, you don't know what you're feeling. You don't know how to feel for it. And number two, your skin isn't at resting tension because you're doing this and moving and you're arching your back and you just had surgery. Like, that's not gonna work. Let's say you just had under here done, right? Just your arms. And you are 5 or 6 months out and you're not in pain anymore, right? But let's say you have fibrosis. You're not gonna know which direction to move in to drain that. Again, in theory, all of this drains into the armpit, right? But here's the problem. You have fibrosis. Swelling is not going to just move through that fibrosis. We have to deal with that first. You guys don't know enough to be able to do this for yourself. Now, let's take another in theory thing that someone told me. Well, let's say I'm 2 weeks post-op, I'm feeling better, I can touch my skin now and I can move it and I don't have any fibrosis. Again, there are lots of different things that you guys don't understand. Like if you've had a tummy tuck and you've had skin removed, and there's literally no way for me to go through the million different things. So I'm just giving you guys examples. If you had a tummy tuck, right? Everything from this line up, everything from the belly button drains up into the axillary. Everything from the belly button down drains into the inguinals. All of this has been removed, and this line is now down here or somewhere in this region. So now we have to reroute the fluid. We need to work with your body's new lymphatic mapping, not this. Let's say you didn't do a tummy tuck, but let's say you had lipo in some areas but not other areas. When you guys do lipo, and this is something, oh, I didn't realize my mic was all the way over here. I don't know if you guys can hear me, but when you guys do lipo, it's not that your vessels are being destroyed, it's that they're not working. Yes, there is a map that we need to follow and a way that we need to work the vessels to get them to reabsorb. But if certain vessels in certain areas of this map are not working and are down, we need to employ other vessels in the body to suction from that area. If one area is super congested, we need to get the other areas to help. You guys have no idea how to do that. This is not just a one sequence type thing. And in my course, so that you guys can guide your therapist and understand what's supposed to be going on during your massages, in my course, I teach you what needs to be opened first and how this works. And then I tell you, your therapist will be able to do the rerouting and be able to help you, because it's not standard. It's not one size fits all. You guys are having surgery. You're changing the landscape. We need to work with that. There's no way for you to know unless you have all this background knowledge of the science. So you don't know enough. You don't know how to do the technique. You don't know what it's supposed to feel like. All of this stuff is what you get taught in a 145-hour, 8 a.m. to 8 or 7 p.m., 7 days, 9 days straight course. You're not going to do that. So that's the next thing. One more thing. Let's say you do know how to do the mapping. Let's say you know exactly what you had done and exactly how your body's supposed to flow. If you are not doing the technique right, you are going to cause backflow. And I see this with a lot of therapists that are not VODR certified or trained properly, and they're doing this, and they're pushing the skin. Your body is one big bag of water right now. Picture a Ziploc bag. What we need to do is do this gentle stretching motion in a specific way. If we look at the arm, we've got the front of the arm with all these channels and tracts, right? And then we've got the back of the arm with even more channels and tracts. Depending on where you had surgery, is going to depend on what vessels we need to employ and which way, which direction, which stroke. It's extremely technical. If you're just doing this and trying to massage following these lines, you're gonna cause backflow, because you can't just do this and then bring it up into the armpit and hope that it works. You don't know what's blocked and what's not. And on top of that, you're one big Ziploc bag of water. The goal is not to push fluid. We're not pushing fluid anywhere, ever. We don't push fluid. Picture a sponge, okay? Forget the bag of water thing, because that was like a whole nother, sponge works better. Picture a sponge, okay? A wet, sopping wet sponge. If you press down on that sponge, water's gonna squirt out everywhere, right? We're not pushing down on the sponge. We're not squeezing all the water out of the sponge. That's not how it works. Your tissue is like a sponge. In order to not spill the water out everywhere, because then it travels all over the table and all over the countertop and onto everything near it, which is what's happening during those massages, is that water is being spilled out everywhere into areas and getting trapped and fibrotic, or backing up into the hand, and somewhere you didn't have surgery is now swollen. And you do this with your massages at home too, and you're like, well, I want this to go away. I keep rubbing it. It's not going away. Or it goes away and then it's in your stomach. And you're like, what the hell? Because it's not about pushing. We need to basically, those little vessels, picture them ingrained in the sponge, okay? In the pores of the sponge. You've got tiny little vessels, and those vessels are not pipelines to drain the sponge. They're these tiny little sump pumps, okay, that reabsorb the water. And picture these tiny little sump pumps in the sponge, and they got little tubes that drain out into the sink, which would be the toilet because you're peeing it out. What we need to do is get those little sump pumps to pump faster, to drain all the water out of that sponge into its natural drainage system, its tubes, so that it goes out into the sink or into the toilet. That is what we're doing with manual lymphatic drainage. Generally, those little sump pumps would take forever to drain you, and then by that time you're already healed, and you healed with swelling trapped inside of you, or you heal and it heals hard. So let's picture that sponge again, and let's picture that we used it to soak up water that had grains of sand in it. Here's why squeezing fluid out of you doesn't work and causes fibrosis, and is also extremely, extremely dangerous. If you have sand in there with the water in that sponge, and you're not activating those little sump pumps, to suck the sand and the water out, and all you're doing is removing the fluid or the water, right? And you're just pressing that out of the sponge, all that sand is going to dry and harden like clay inside of that sponge. And there you have fibrosis. That's how fibrosis happens. So when you're doing, and I hear, guys, this drives me freaking nuts. I swear, I cringe so hard when you tell me this. My doctor told me to just drain myself. So I have my incision open and I'm just squeezing fluid out in the shower. You're leaving behind all the proteins, all the sand, and on top of it, you're squeezing into that sponge, breaking tissue, causing more blood and fluid to build up. So you will constantly be expressing fluid out of your body 24/7 because your body thinks that it's getting injured. So it's making more swelling and more fluid. Please do not push fluid out of yourself after surgery. Please. For the love of God. And do not let anybody else do that either, because you are restarting the phases of wound healing, delaying your healing, causing thicker tissue to build up, and breaking tissue, causing more blood and fluid. Can we not? Please, just don't do that. That is not the solution. That is not how the body's supposed to heal. That's number one. And number two, if you're doing your massage thing, right, you're just squeezing that sponge, and let's say there's a sponge next to it. You're squeezing water by doing this into the sponge, into another sponge that didn't have surgery, that is now blown up. So we are not squeezing, we are not rubbing, we are not pushing, we are not doing any of that. It is an extremely, extremely scientific mental technique. It is not aggressive or rubbing or any of that. And you guys don't understand that. And that is why I created my courses, to teach you that. Because if you understand this map, if you understand the phases of wound healing, if you understand how the lymphatic system works on its own naturally and how manual lymphatic drainage technique works, then you're not going to be rubbing yourself, because you can't, because there's no way. You don't know enough. You don't know what pressure to use. You don't know what direction. You're going to cause backflow. You're going to cause fibrosis, all of these things. I have so many people come to me that have been massaging themselves because their surgeon told them to just rub, like chin lipo, just rub and it'll go away. And it hasn't gone away. It's gotten worse. They don't know what they're doing. It's piling up. It's swelling even more. Or now they have new areas that didn't even have surgery that have swelling. And we have to open up the system and get everything to reabsorb and work 10 times harder, because you've now caused fluid in an area and congested, because manual lymphatic drainage is decongestive therapy. You have congested an area of tissue that was not congested and did not have surgery, on top of this area still trying to heal, the original area trying to heal with all the trauma that you just caused. You guys don't know what you're doing. And when you go to someone, the other reason I created the course, when you go to someone who says they're doing manual lymphatic drainage or lymphatic massage or lymphatic drainage, and they are doing the same thing, and they're not going with the science, and they can't explain anything to you, and they're just rubbing and like doing all kinds of things, using tools and oils and machines and everything, or it's even worse when your surgeon sends you to someone like that, you guys can't advocate for yourselves. And then you spend all this money and you have no idea what's going on because you're not healing right. And it's 9 weeks out and you're having all these complications, right? Complications, fibrosis and swelling, all these problems, and you don't know what to do because you don't understand. You think it's as easy as a massage. Manual lymphatic drainage is not massage. It is manual manipulation of the skin. It's not even the actual definition of massage, and I will put up a post next week showing you guys the difference. The actual definition of massage is working with soft tissue muscles and working them. We're not touching any of that when we're doing this. We're only working with the skin. That's it. We are not touching tissue underneath or ligaments or tendons or deep rubbing. It is just the skin that is being moved and manipulated. That's it. So it's not what you guys think it is, and that's where you run into this problem, because if you really understood it, you would never try to massage yourself. And then when you do try to massage yourself, Yes, it may get softer. Your fibrosis may get softer. Yes, it may feel good and you may stop being sore and it may feel better, but you're still going to have swelling because you're not addressing the lymphatic system, or you're bypassing the lymphatic system. You're not doing the motion that's going to stretch. Picture a spider web, and we want to just gently stretch the spider web and get it to contract and release. That's how delicate and gentle it is. But if you stretch a spider web just any which way, you're going to break it. It has to go in accordance with the vessels, with the strings of the spider web. You can't just pull on it and call it a day. It's very, very technical. So if you're doing your self-massage, right, at home, and you're just rubbing all kinds of willy-nilly, and you're just using whatever pressure, and you're using oil, yes, any kind of fibrosis may soften, but fibrosis, as we know from my several videos, and I talk about it a lot in the course, if you're trying to do self-massage, and you're like, I have fibrosis, I need it to go away, take the course, please, for the love of God, take the course, because you're just going to make more swelling, because fibrosis is a condensed, congealed, thickened form of swelling. It started as swelling, it got trapped, it got stuck, it got dehydrated, it got compacted, and now it's fibrosis. You go rubbing that and moving that and pulling that, you're going to cause more inflammation. Fibrosis is an inflammatory process happening in the body. It's constant inflammation. Swelling is not constant inflammation. Swelling is fluid. Swelling is healing juices. Fibrosis is constant inflammation. It's going to make more swelling all the time. And if you rub away at that, you're going to continue making more swelling and add to your fibrosis. And let's say you get rid of your fibrosis, you're going to get even more swelling. So when you're doing back to my point again for the third time. I'm sorry, guys. There's a lot of notes. When you're doing that and you're like rubbing into the tissue, or you're like raking or doing like whatever kind of self-massage thing you guys are doing, even if you're going slow and you're doing like this, when you're doing that, you're not actually working that spider web. You're working tissue and muscle, and you're working against bone and all of the structures underneath. You're not actually touching that spider web. You're going right through it. You're just bypassing the whole thing. So it's not going to work to absorb and stimulate the vessels. Manual lymphatic drainage massage works immediately. People are like, oh, how long is it going to take for me to see this work? The minute I put my hands on you and I start working on you, your skin and your tissue starts absorbing that fluid instantly. It is manual. It's literally like, you guys ever seen those little water things like you have on a farm, the water pumps with like a bucket, and you do this, and the suction of the pump makes the water come up and out? That's literally what we're doing to your system, but inside. We're literally doing this with the little pumpy thing as I'm pumping your skin. The little handle's doing this, and your body immediately begins to suck the fluid back into you so you can pee it out. I have a video on my Instagram of the lymph vessels and how they actually open and absorb fluid and close and spit fluid out through the system back into your body. It's a reel on there somewhere. But this is not, you guys don't know what you're doing. And now, okay, so now that we've covered that, when your surgeon tells you to massage yourself, I want you to ask them, what am I supposed to be doing? Tell me, what am I supposed to be doing? And they're like, oh, just rub. Just rub your skin. And then I want you to go, okay, well, how is that supposed to work? What is that going to do? Because they don't know. Surgeons don't know any of this. They know the word lymphatic. They don't know what that means. They know that the system exists. They don't know how it works. They know that the technique in massage helps. They have no idea why or what it is. So when your surgeon tells you to massage yourself, what they're telling you is you should know how to get rid of your swelling by doing this massage. So go do it. Guys, you don't. There's no way. You don't know how to reroute. You don't know the pressure to use. You don't know how the technique works. You don't know the 4 different strokes. You're not going to take a 135-hour CLT course, which you're not even eligible to take unless you have a massage license or a PT license or a nursing license or something. You guys, this is not, you can't do that. When you go to someone that's a therapist and they're just rubbing you and you're like, oh, I could just do that at home, then it's not manual lymphatic drainage, because you can't just do it at home. Even my clients that I see, they'll be like, oh yeah, I was trying to like do it the way you do it. And I'm like, and which direction and which stroke and what was your pressure and what pathway were you working in. Like, you're just rubbing your skin. You're not actually doing anything. And they're like, oh, does it help if I rub myself at home? No. And honestly, I tell you guys not to. Please don't touch yourselves at home. Don't at all, because you don't know what you're doing. You will undo the work that I did. You're going to be working in the wrong ways, working in the wrong pathways, moving things in the wrong direction, and it's just going to backflow and make a mess of what we're doing. When you have a client with lymphedema, which is chronic swelling, they will always have swelling for the rest of their life. I have had clients with lymphedema that will come to me, but because it's not covered by insurance, they'll go to a PT somewhere else. Then they show up like 6 weeks later with their arm and hand blown up bigger than I've ever seen it. And I'm like, who did you go to? They're like, oh, I went to this physical therapist and it was only 30 minutes. And I feel like she was going in the wrong direction because my hand hurt so much afterwards that it like blew up. And it's been blown up since. And my garments aren't working to bring it down. Because the person you were working with did not open the main lymph nodes and did not use the correct pathways. Now, someone with lymphedema, either mechanical or dynamic insufficiency, primary or secondary lymphedema, we don't need to get into those terms. But what that means is they, for whatever reason, their lymphatic system is deficient or broken or doesn't work and never will because they either had lymph nodes removed or their vessels, they were born with too many vessels, abnormal shaped lymph vessels, or not enough lymph vessels, that their body does not reabsorb fluid the way it's supposed to. Which means I, as a therapist, need to look at where the healthy lymph nodes are, where the healthy lymphatic pathways are, and make sure that I'm dilating certain pathways in a certain way to get those things to pump to drain all of this out. If I'm working in an area and I'm trying to dilate vessels where there are none or where there are no lymph nodes, and I'm bringing the fluid, or I'm dilating the vessels in that area, which is bringing the fluid to that area, and I'm not employing the rest of the healthy vessels everywhere else to continue bringing that fluid into the body, it will congest that area because they don't have the parts for their body to normally decongest itself. It is a very, very technical thing, especially with someone with lymphedema. And the problem that you guys run into after plastic surgery is you don't understand that. You just think it's massage. You just think it's, oh, this is just a massage. This is not a massage. Guys, manual lymphatic drainage is used for cancer recovery, lymph node removal, lymphedema, lipedema, filariasis, which I'm going to do a video on. Filariasis is a condition where basically it comes from mosquitoes and it eats away at your lymphatic system, and you don't have any more lymphatics, and you will always, always, always have swelling because the thing that's meant to get rid of swelling is no longer there. So it develops lymphedema from filariasis. It's a whole thing. We'll talk about it later. But they don't have any of the help in their body for it to normally pump, so manual lymphatic drainage is needed. Autoimmune diseases, where you have chronic inflammation. Your body's constantly making inflammation, and the thing that gets rid of the swelling and inflammation isn't working for whatever reason. Manual lymphatic drainage is used for all of these medical conditions. Plastic surgery is a medical surgery. It is no different. You should not be getting a regular massage. You should be getting a manual lymphatic drainage massage, which is manual manipulation, which is not massage. I understand that it's called massage, but it is manual lymphatic drainage. It is a technique. It is not a rubbing massage. That's not how this works. So when we're talking about plastic surgery, your system is not broken. Your system is not like damaged. Your system needs help because it's overloaded. And I want to make this distinction very clear to you guys. Your body creates swelling to heal your tissue. The only thing responsible of getting rid of that swelling is your lymphatic system. Your lymphatic system does not create swelling. After plastic surgery, there should be no reason that you are re-swelling. If you are, it's a therapist or you trying to rub yourself causing more inflammation. The cause was the surgery. We shouldn't be having any more causes. If you're not working with someone like me who's a plastic surgery recovery specialist to explain to you guys all the things that you could possibly be doing during your recovery that's going to create more inflammation and more swelling and have more swelling events, then yeah, you're going to see your swelling rebounding, or you're inflating out of nowhere, or it's getting hard and all these things. That is not necessary. With someone like lymphedema, their body will always have swelling because the body normally has a swelling event, right? Let's say heat, you're out in the heat, you swell, a night out of drinking, you swell, things like that, right? Your cycle, if you're a woman, you swell because of prostaglandins, it's normal. Your body has these swelling events. Your lymphatic system is supposed to take those swelling events down, and it's a one-way track, takes swelling out of the body. If you have lymphedema, that one-way track is not working and not there, so you will always see swelling present because that one-way track is not there, because normal life events are going to happen, and that track isn't there to take it out, so you're going to see it build up. With plastic surgery, the tracks are still there. All of this still exists, but it's congested. And it's kind of like the train track's broken down a little bit, so the train can't move. And as your body's healing and repairing the track, it should start to move. But guess what? If we load that train up with coal, lots of coal to the point where it's too heavy, it's not going to move on that track. So our job with manual lymphatic drainage is to get a lot of that heaviness off so that when your body's healing, it can start processing on its own. And this is where, the reason I'm mentioning this, self-massage for maintenance. Guys, there is no maintenance. You have a track that's working. You had one swelling event, which was surgery. You may be causing more little mini swelling events, like being out in the heat, having alcohol, having caffeine, not having enough water, having too much salt in your diet, having somebody raking through you or you raking through you, causing more swelling. You may have lots of other mini events. But the reason you are swollen is from surgery, because your body needs that swelling to heal. We know this. So our job is to get the excess off so your body can heal and that train can move forward, because guess what? Your body's going to heal regardless. But is it going to heal with all that swelling, that big train full of coal stuck inside there? Or is it going to heal nice and flat and fresh and soft and perfect? If you are constantly pushing fluid, trying to rub, trying to massage, you're going to be adding more coal to that train. That train already has coal on it from surgery. You're going to someone who's creating more swelling because it's creating more swelling events. You're rubbing yourself constantly, damaging that tissue, and your body's sending in more swelling because it needs to heal. It's not that you're re-swelling. You don't have a re-swelling problem. It's that you're causing more swelling with what you're doing, with these self-massages, or you're backing up swelling, loading it onto the back of that train because you don't know what you're doing. Please do not do the self-massage. It's that simple. We say no to self-massage. And listen, there are lots of other opinions out there. I am telling you guys off of the science. I am telling you guys off of the technique. I'm telling you guys off of my 9 years of experience, fixing you guys who keep doing this self-massage stuff because your surgeon told you to, because the lady that does your massages told you to, because you don't want to pay to get your massages, so you're just going to do it yourself. Please, this is not that simple. The plastic surgery was not that simple. This is not just get a massage and call it a day. It is a medical thing. You cannot be doing things like that. It's going to cause issues. And even if it doesn't cause major issues, right? Let's say it makes, like I said before, makes your fibrosis better. It doesn't mean you don't have swelling. It doesn't mean your skin's going to retract perfectly. It doesn't mean you're not going to heal with swelling inside of you. And just because it feels good doesn't mean it's doing good. So please, no. And again, if you do not understand what's supposed to be going on during your massages, I explain a little bit in these videos because YouTube takes literally 6 hours to upload a 45-minute video. It is insane. And I can't even upload these videos to Instagram because Instagram doesn't let me upload full videos. It takes 3 days to upload a full video. So all these videos are on YouTube. But you guys don't understand what these massages are supposed to be. You go to these therapists and you think they know what they're doing, but you're not seeing the results. You're not understanding. You don't know how to take care of yourself. Our course teaches you this map, why you can't do self-massage with this map, with your body, why you should not be doing it. Yeah, can you? Of course, anybody can do anything. Should you? No. what your therapist is supposed to know in order to help you, in order to do the technique properly. What credentials to look for to make sure your therapist knows what the heck they're doing. Because I swear there was somebody on Instagram yesterday that like commented on one of our posts, and I was just like mind blown at the things they were doing to clients. And I was like, what is happening here? And they're like, yeah, it's VOD or MLD. And I was like, I don't engage. You guys know, I teach you guys the science, I do the thing, and that's it. But there are so many people out there that have certifications for manual lymphatic drainage and are still using oil and rubbing. You'll still see fluid coming out of people on their page, and they'll say, oh, it's not my fault if fluid just spills out while I'm doing the massage. Guys, sponge. Okay, sponge. If we're doing the massage properly, no fluid is spilling out anywhere ever. I have clients come to me 48 hours after with incisions that are open, covered with gauze. No fluid is ever leaving anywhere no matter what. I have so many videos on this, but guys, sponge, okay? We're not using any downward pressure. The technique itself is not doing anything that could ever cause fluid to come out of an incision. Ever. And that goes for a drain too. We're not pushing fluid towards a drain. There's no pushing of anything. Sponge, okay? All of that is in the course because you guys go to these people and they say they're certified. They say they've been to the school. They have the certification, but they're still pushing on that sponge. And they're still using oil, and there's still fluid coming out, and they're still rubbing, and they're still doing all this craziness, using machines, all kinds of stuff. You guys need to truly understand what your body's going to be going through. The 3 most important things in the course is, number 1, I teach you all the phases of wound healing. I teach you how fibrosis is formed, how it's an inflammatory process, how swelling is supposed to work in the body, when it's supposed to stay, when it's supposed to go, when to know when there's a problem. That's the biggest thing, is when to know when there's a problem with your massages, when to know when there's a problem with your swelling, when to know your massages aren't working, when to know your massages aren't the right thing. You guys will find the world's greatest manual lymphatic drainage therapist, but they will know nothing about plastic surgery. And then you guys think, oh, it's my therapist, she's terrible. No, you don't know how to help your therapist help you. They don't know everything. Guys, I don't know everything. You know the reason I do these videos? Because you guys ask me questions and I'm like, you know what? I do know why, but I want to verify first and I want to check. Like the ulcerative colitis video that I just did. Or the Renuvion video that I just did. Because I want to really fully understand it so I can help you guys better, but also so I can explain it to you. Because if you fully understand it, you can help me by telling me what's going on in your body. You are living in your body. You are the only one that's going to know whether your massages are working, whether it's real MLD or not, whether it's actual manual lymphatic drainage that you're getting. Because your surgeon will tell you, oh, just massage yourself. Or you'll go to a therapist and they'll do all kinds of things to you, tons of treatments in one session, or rub the living daylights out of you with oil and you look great, but then the next day you're in massive pain, you're blowing up, you're more swollen than before, your garment doesn't fit anymore, or your garment's extremely painful, and you know something's wrong, but you don't know enough about your body's healing and the phases of wound healing and how fibrosis is made and how swelling is supposed to work to be able to say, this is the problem, this is what I need to fix, this is why my body's not healing. That's literally the purpose of my whole course. Because guys, like I said, I could give you a million scenarios. I could tell you a million different ways to use this lymphatic mapping in your body with your specific condition and your specific surgery and your specific swelling. I'm not in your body. I'm not there. I can't do that by a picture on Instagram. Please stop sending me naked pictures of yourself on Instagram. Please, for the holy love of all that is good, I do not want to see your body unless you are a client and you are in the room with me and it's going to matter because I can't help you over a picture, over an email. This is a lot more technical than that. And by taking the course, you guys understand that and you can take the steps you need to heal properly or to fix what's not healing or to start your healing process and to go into this surgery with confidence, knowing that you know how your body's supposed to heal, you know how the swelling is supposed to work, you know how the swelling is supposed to feel, you know when something's wrong, so you can go find the appropriate help. And then you know who to get that help from. You know that they have the certificate, but you know what they're supposed to be doing in the room with you. This is not a mystery. It is a science, guys. We have the science. I teach you the science so you can differentiate and find someone that can help you. But more importantly, that you can help yourself. Because again, you guys are trusting these therapists and they're doing all this craziness to your body. No one's explaining anything to you. Everyone is telling you something different. There is literally no reason anything should ever be told different. We have the science. We have the map. We have plastic surgery textbooks explaining to you in here. Oh, I lost my bookmark. Explaining to you guys in here the exact massages you need after surgery, which is manual lymphatic drainage. I actually have a video where I go through the plastic surgery textbook and literally read to you guys the part where they talk about, oh, it is bookmarked. Post-operative instructions. It is in here. Compression garments, talks to you about that. Bathing and showering. Oh, look, the massages you need. Manual lymphatic drainage, MLD massage, is recommended that you start as soon as 2 days following your procedure. This specific and gentle massage should be performed by practitioners specifically trained in the technique. Wow! Plastic surgery recovery textbook is telling you. Like, that's Kathleen's book. She says it in there too, though. If you guys don't know Kathleen, I love Kathleen. High definition body sculpting lipoplastic surgeon textbook is telling you the massage you need is specific and gentle by someone specifically trained. This will help to accelerate healing, reduce hardness, improve bruising and swelling, and improve results. Right there. Guys, this is not a mystery. And I teach you all of that in my course because you need to know. You need to understand what's real and what's not. And again, you guys are going to do what you're going to do for your healing and what you need to do. You can, self-massage until the cows come home. And you know what? If that works for you and if you're satisfied with your results from that, that's okay. That's fine. But there is a better way. There's an easier way. There's a safer way. There is a straightforward way where it's not confusing, where you guys aren't just doing things willy-nilly, and all of that is in the course. I literally take it and put it in one straight shot for you, one straight line. Here are the phases of wound healing, Module 1. Module 2, here's how the lymphatic system works, because the phases of wound healing are going to happen no matter what. You had surgery, you have a wound. Lipo is one giant wound. Tells you all about that. Module 2, all about the lymphatic system, your one-way track of getting swelling out of the body, how this is supposed to work, how your body is supposed to heal. Module 3, manual lymphatic drainage, the actual technique for manually pumping your body to speed up its normal drainage system so that you heal without any swelling. So that we get all of that out before you hit those phases of wound healing where your surgery becomes permanent. Because that's the goal, is to get all of that excess swelling off of you before you start getting into that second and third phase, or that third and fourth phase of wound healing, where everything that's there is going to become permanent. Because we don't want that becoming permanent. Module 4, all about your therapist. All about what they should know. All about how it's done, things that you should know about your therapist, things you should know about your massage, when to start, when to stop, if it's working, what should not be done during your massages, because then they're just post-op massage, they're not MLD. And notice how in that book, it didn't say post-op massage. It said manual lymphatic drainage specifically. That's what you need. So Module 5 is all about all the craziness. So what supplies should you be using? I myth bust some things about like the ice and the heat and explain why those things are not, why we're not doing those things. I myth bust things about like the rollers and all of these like common things that you see. All of like the little extra questions are in the bonus module. The first module is technically the intro. So all of those modules are 2, 3, 4, 5, and 6, I believe. But either way, guys, it's your basics. Everything in there is your basics. What your body's supposed to be doing to heal, what it's supposed to look and feel like, how to know when there's a problem, what your massages are supposed to be like, what they're not supposed to be like, how to find somebody, and how to know if they're being done properly. That's That's really it. Because again, you guys truly don't understand this stuff. And that's where you have the problem. That's where we get into trouble. That's where fibrosis builds up. That's where all of these crazy things that you hear and see start happening. None of that needs to happen. Just because it's common does not mean it's normal or right. I get you guys asking me all the time, is this normal? Is this normal? Is this supposed to happen? Is this normal? Does it need to happen? No. Is it commonly happening because of terrible post-op care and you guys have no idea what you're doing and I am the only person out here literally screaming it to you guys about what you should be doing, when you should be doing it, and what's supposed to happen and what's not supposed to happen, and whipping out textbooks? Yeah, you guys don't know. So the link to the course is in our bio on our Instagram. It's also going to be in the description box, but it's on our online shop, amarepostopshop.com. I also have a couple videos talking more about the course, like in depth explaining it to you guys on the product page for it. And then if you guys need your supplies, if you find other videos, all of my other videos, and you're like, all right, I actually have a video that I recently did, like the only supplies that you actually need for recovering for any plastic surgery, like the basics. I have a video on that somewhere in my YouTube channel. So if you find it, you can get all of your supplies. And if you don't know what supplies you need, if you go onto our post-op shop and you click on the product, there's a video explaining the supply, how to use it, what you would need it for, all that stuff. So that is amarepostopshop.com. And then if you guys need me, I keep getting this question a lot too. Should I take the course first or do a virtual? Guys, the course is 4 hours of content. Take the course first, because 90% of the questions that you guys have and you're spitting at me in a 45-minute virtual, I don't have time to answer all of that. The virtuals with me are, okay, this is what's going on. I have this exact problem I need help with. And I mean, you can, like, I know nothing helped me, but we're going to need a couple virtuals for that. And it's way cheaper to just get the course first, get all the background knowledge, and then do a virtual with me so you make more use of your virtuals and we need less of those sessions. That's also the other reason I created it, because I didn't have enough time to explain to you guys everything I wanted to explain to you and really, really go deep so you fully understand the science of everything. So the virtuals, the course, the products. Oh, me. Hi. I'm in New Jersey. So if you're in Jersey, Highland Park and Elizabeth, if you guys need to schedule a virtual or want to come see me in person, if you are in New Jersey and you're like, yeah, I need to see her, or if you're in the surrounding area, I get people that come from Connecticut, Boston, Pennsylvania, New York. I have people that fly in from Florida and stay for like 2 weeks to see me. So we're in Highland Park and Elizabeth, New Jersey, if you need an in-person session with me where I can actually be your therapist and do all of this with you guys. But the phone number for scheduling your sessions is 732-841-0142. amarepostopshop.com, link in the description box, link in the bio on our Instagram. And guys, I think that's pretty much it. Please just don't do the self-massage. Get real manual lymphatic drainage, please. And I love when people are like, I can't find a therapist. That's the point of the course, guys. We're out there. I know tons of great therapists that are out there. None that do plastic surgery specifically, and they probably aren't going to be in your town or close to you, but there are lots of people out there that do the technique perfectly and understand the science and the concept, and it works immediately. It's just you're not looking for them in the right ways. You're not asking the right questions. And I teach you the questions to ask in the course to find that person. You're going about it all wrong. You want a post-op person. It's not what you need. That book didn't say post-op. It said manual lymphatic drainage. You need an MLD therapist, a really good one. You don't need a post-op person. Sometimes you get a unicorn like me, or like a little post-op fairy that does both. But nowhere do I say post-op massage. It's post-op manual lymphatic drainage. It's not post-op massage. But again, I do post-op, but I also work with lymphedema, lipedema, Lyme, cancer, autoimmunes, RA, fibromyalgia, knee surgeries, hip surgeries, tooth extractions. I had a tooth extraction once, swelling from that. Like all kinds of swelling. I'm a swelling specialist. I'm not exclusively plastic surgery, although I do talk about it a lot because it's very needed. I'm an MLD, CLT, like person. I do all the lymphatic things, all the swelling issues, any swelling issue, not just plastic surgery. So you guys are like trying to find a post-op MLD person, but you don't even know what you're looking for. So take the course. I do not recommend rubbing yourself. That's just me. I mean, you guys do what you need to do. Do what is right for you. That is my school of thought. That is my opinion. But other people have other opinions. So you're going to do what you're going to do. But that's just all the science, all my reasons, all my notes. I'm just going to check my notes, make sure we're done. Yep, that's it. Okay, guys. Ashley with Amare. I will see you all very soon. Bye.